So May is Mental Health Awareness Month. But as a physician, I want to tell you that we've been getting that wrong for like 50 years. I spent the last 3 years treating over 800 patients in my office. So these are people with depression that just wouldn't lift, or anxiety that they couldn't just think their way out of, trauma maybe that they've carried for decades. You know, the kind of burnout that doesn't just go away with a vacation. And here's what those 800 patients have taught me. It's not your mental health that's broken. It's actually your brain health. And those two things, they're not the same. But when we keep talking about Mental Health Awareness Month, we're just continuing this idea that it's mental health, but it's not, it's brain health. I'm Dr. D. Bonney. I'm a board-certified emergency physician, and I run Alpha Omega Wellness, an IV ketamine therapy clinic in central Indiana. And we treat the people who've been everywhere else. They've tried every prescription that their psychiatrist has suggested that they try, or they've sat across from what seems like every therapist that's within driving distance. These are people who've done meditation apps and cold water plunges and, gratitude journals, breathing exercises, and yet they still wake up every morning bracing for the day. Now, I'm not against those things. I want to be very clear about that. I mean, therapy, it works. Medication sometimes works for people. Mindfulness can be effective, but for a lot of people, they only get you so far. And if that's where you are right now, this video is for you. Because the reason that those tools stopped working or never quite did, it has very little to do with you. And it has almost everything to do with the language that we've been using to describe what's actually happening inside your skull. So here's the problem with the phrase mental health. It implies that your mind is somehow separate from your body, that your mood is this abstract thing that's floating up there in your head somewhere. Something that you should be able to think your way out of if you just had the right attitude, the right reframe, the right podcast. So then when you can't sleep, we tell you to just talk about it. Or when you can't focus, well, get a journal, write things down. Or when you can't get out of bed, well, we tell you to take a walk. And when none of that works, we tell you to take a pill. And when the pill stops working, and I'll get into why that happens in another video, we tell you, well, it's just complicated. Maybe you're just one of those people. You just have to live with this. So I want you to hear me very clearly. When you're experiencing the fog, the dread, the heaviness, the not sleeping, the racing thoughts, or not feeling like yourself, it's not abstract. It's not in your mind. It's not in your character. It's not even a willpower problem. If it was, you would have already fixed it. It is a measurable, biological, structural problem in the physical organ inside your head. And the moment that you stop calling it mental health and start calling it brain health, the path forward, it changes completely. Let me show you what I mean. I'm going to give you a 2-minute neuroscience lesson that's going to be more useful to you than any pill bottle that you've ever held. So let's talk about just 3 structures in the brain. That's all I want you to know for today, just 3. First, we have the prefrontal cortex. So that sits right behind your forehead. This is your executive function. Think decision-making, focus, planning. It's the thing that keeps you from saying what you're really thinking in a meeting, but it's also where most of your emotional regulation lives. Another area here, your amygdala. That's deep inside your brain. That's the threat detection center. It scans for danger 24/7. It's been doing that since you were a caveman, and it doesn't know the difference between a saber-toothed tiger and an email from your boss at 11 p.m. This area right here is your hippocampus. It sits right next to the amygdala. Memory and learning specifically happen there. But it tells the amygdala which threats are real and which ones it can stand down on based on prior experience. So in a healthy brain, all 3 of these work together smoothly. Let's say the amygdala fires a potential threat. Well, the hippocampus, it checks the memory file, and then the prefrontal cortex evaluates the actual risk and makes a decision. The threat passes, and you move on. But here's what happens when the brain gets unhealthy. In a chronically stressed, depressed, traumatized, or burned out brain, and chronic doesn't have to mean decades, it can mean a hard 6 months. This balance here shifts. So the amygdala gets bigger and more reactive, and then the prefrontal cortex and hippocampus, those literally shrink. So the connections between them weaken. Now listen, this is not a metaphor. We can actually see this on imaging studies. The brain's physical shape actually changes under chronic stress. But there's a molecule in your brain that I want you to know the name of. It's called BDNF, brain-derived neurotrophic factor. I like to tell my patients it's like Miracle-Gro for the brain. BDNF is what actually allows your neurons to grow new connections. So to repair damaged ones, or to stay plastic, meaning able to change. When BDNF is healthy, your brain is updating itself constantly. New experiences create new patterns. You learn, you adapt, you actually recover from a bad day. But here's what chronic stress does. It drops BDNF, like it tanks it way down. So then your brain stops being able to update itself. And the patterns that actually helped you survive that hard year, the hypervigilance, the bracing, the not actually feeling your feelings, they become the only pattern that you can run anymore, even after the hard year is over. And that's why people tell me all the time in my office, they say something like, I know logically that I shouldn't feel this way, everything's pretty good, but I still can't stop. Your logic is fine. It's your structure that's stuck. So here's why I'm telling you all of this in a video about Mental Health Awareness Month. When somebody tells you you have a mental health problem, even when they have the best intentions, essentially what they're saying is, there's something abstract going on with your mind and you should probably just talk about it. And when somebody tells you that you have a brain health problem, the conversation changes dramatically. You see, brain health, it's structural. Brain health is measurable. Brain health is treatable. Not just with talk, not just with pills that target 1 or 2 neurotransmitters. So if you've tried therapy and it helps, but it only goes so far, your brain just wasn't ready for that update. Therapy works through neuroplasticity, but if your BDNF is on the floor, therapy can only go so deep. So no matter how good your therapist is, it might not really move the needle. Or if you've tried antidepressants and they kind of took the edge off, but you still feel like a thinner version of yourself, that's because they're working on the chemical layer, not the structural layer. And if you've been told that your case is treatment resistant, really what that just means is that the treatments that we've tried haven't targeted the structural issues. You see, in my practice, the treatments that work on the structural layer of the brain are working on BDNF. They're working to boost neuroplasticity on the actual physical connections between these regions that have been impacted by chronic stress. You see, that's where IV ketamine therapy comes in because it's the most well-studied glutamate modulating intervention that we have right now. And we'll talk about how it works specifically in another video, but today, I just want to leave you with a reframe, if I can. You do not have a mental health problem. You have a brain health problem. And your brain, it's a physical organ. It can be measured, it can be supported, and it can be healed. So stop asking providers, like, what's wrong with my mind? And start asking, what's happening structurally? What does my BDNF look like? Which part of my brain is actually taking the heaviest load? And what treatment targets that structural layer, not just the chemical layer? So those are the types of questions that actually lead to better answers. So listen, if this resonated with you, if you can relate to some of these symptoms and you want to know about this therapy, in the description below, there's a link and you can come over to our website. And there I have a video where I kind of walk through how this medicine works, who it's good for, maybe who it's not a good fit for, and go through, watch that, learn a little bit more. And if that seems like something that could help you, let me just encourage you to book a free consultation with my team. And that way we can go through what you've tried, what's worked, what hasn't. We can kind of understand where you are and just have an honest conversation to see if this therapy could actually help you move the needle. I'm Dr. D. Bonnie. So if you found this useful, please hit the subscribe button. There's a lot more coming out this month, including the SSRI plateau video that I mentioned. And if somebody you love is in the middle of a bad year, just do me a favor and send this to them. Because remember, it's not mental health, it's brain health. I'll see you in the next video.